This is a tough time. It's Thanksgiving. It's a time when we all want to be with family and friends. It's a time when we give thanks to God for our grace and the things that are good for us. But this is awful in terms of COVID. People are dying. People are getting sick. Businesses are hurting. People are losing jobs or not gaining back jobs. Kids' schools life, whether it's K through 12 or college, is disrupted. It's awful. And we think about that. And that means we have to do everything we can to fight this awful COVID crisis. The worst crisis, economic crisis, since the Great Depression. The worst health crisis in 100 years since the Spanish pandemic flu. And so I want to compliment our local officials, both the health officials, the elected officials, and the hospital officials. They're doing a great job here, but without all the resources they need. And here is something that's unacceptable, and that is while Orleans County does not have any designated sites for 100% free COVID testing, vital to fighting this disease here in the county, the federal government is sitting on $9 billion that can be distributed to New York State and to New York counties and institutions to do testing. And we are demanding that they get that $9 billion out. This is not money that has to be approved by Congress. This was approved in a bill I helped write with the President Trump's Secretary of the Treasury, Mr. Mnuchin, in the CARES Act, but the money hasn't been sent out. It should be sent out immediately as this crisis grows. Residents here in Orleans County and many other of our more rural areas have to travel all the way to Buffalo or Rochester for a free test, and that's not a rapid test. It takes days to get the results back, and that's unacceptable, given that we may have a second wave here in upstate New York, not to mention the difficulty of traveling to a distant center, especially these days, if you're an older person. If you're an older person and can't drive or whatever, it's next to impossible to get there. And regardless of Washington, D.C. divisions, we need to agree even more as the winter approaches on things that can help people out, because COVID is not a Democratic or Republican disease. It's an evil and awful disease. So I'm demanding two things today. First, that the Department of Health and Human Services in Washington release these billions, because the intention of Congress was to apply them to this crisis. And second, that our country come together and the Congress come together in a bipartisan way and expand the testing regime as the winter approaches. Look, Orleans County alone will need hundreds of tests, maybe thousands a day, should this wave hit hard. Every person who works at the hospital has to get a test to make sure they're okay. People who walk into the hospital have to get a test, and so many others. And Orleans' positive test rate was 5.9% this week. On October 1st, it was only 0.6%. On November 1st, it was only 1.4%. So we can see it going up. We need the testing that's commensurate. The number of people checking into Finger Lakes Region hospitals has gone from 32 on October 1st to 211 this week. That's a 600% increase. That's a big increase. That's just shy of the 218 hospitalizations, this in the Rochester Finger Lakes area, that was experienced in May. Orleans County has had an average demand of 300 tests per day, even before the rates started increasing. Now they need to do this right, and that's what they want to do. 7 to 8 rapid test machines, thousands of rapid test kits. Right now they only have 2 machines. Now, while Orleans Community Health has tests, more are needed. While our hospitals are doing yeoman's work, testing as many people as they can, they need more help too. And so the fact that the $9 billion is sitting there, and by law it can be distributed to the state, to the county, or to institutions like Medina Hospital, is amazing that it's not being done. So, we got to get this done. It's not the county's fault. It's not the state's fault. It's not the hospital's fault. They're all stretched very thin. As I said, I negotiated the CARES Act. Medina Hospital received $3.8 million to help our hospitals stay good, but now they need help with testing, and they'll probably need more help in the other way as well. Okay, I think that's all I'm going to say. It's simply put, HHS, use the money. I wrote to Leader McConnell. He's the leader of the Senate. He has refused so far to have negotiations, but now, today, we've had discussions and we're sitting down. We have to get aid, not just testing aid. We need aid for businesses. We need aid for unemployments. We need aid for state and local governments. We need aid for many things. I am supportive of the HEROES Act, which includes that, is supported by the elected officials, Democrat and Republican, of the state and the country, and hopefully we can get that done. Until this point, Leader McConnell has refused to put any bill on the Senate floor. You know the House has passed the aid. In the HEROES Act is ample money that the state would not have to cut any school aid, and it passed the House. We need it to pass the Senate, or some compromise that comes close. And one of the bottom lines here is we need state and local aid because it affects our government, but it also affects our schools and many other places where the state gives aid, and that's at the very top of our list. Wait. Yes, there are shortages of PPE as well, and again, in the HEROES Act is money to, this hospital, they can't spend all their money on, they don't have enough money to do adequate PPE after a while, PPE, and so we definitely need that money. The president is not on board with doing this, but we don't need him. If the Democrats and Republicans in the House and Senate come together, we can get this done. That's what we're trying to do. For the first time, we're having some productive conversations in a while because Leader McConnell has now said he would sit down and talk. The bill that McConnell put on the floor, which he called skinny and most people called emaciated, had no local and state aid, not an adequate money for testing, and all the other things. So if we can get the HEROES Act, we can get it done. I negotiated the CARES Act, the bill you talked about, which did so well, with the Secretary of the Treasury, Mnuchin, and it worked. But no one thought that COVID back in March would be still going now. We need something very similar and strong, and that's what we're trying to do. Yes, it would be even better. The PPP program would be included, and strengthened. The PPE program would be strengthened. The money to state and local governments would be much higher than in the original CARES Act.
Yeah, so we are very appreciative of the senator continuing to advocate for additional rapid testing for rural areas. Obviously we're here today talking about Orleans County, but obviously I represent Genesee, and I talk to my colleagues all around the state that are representative of rural counties, and adequate testing has been a significant issue for us in the rural areas since this pandemic began. As we know, we talk about it quite regularly, and not having the type of access we need continues to be a challenge, especially with our cases increasing as we report out every day, and we've seen regional numbers start to increase. Being able to identify positives quickly and in real time to make sure that we can safely and effectively deal with those situations and their close contacts is essential. In addition to that, there's obviously a lot more testing requirements now for asymptomatic testing, which includes those that may need it for travel, for visiting loved ones in the nursing home, for school-related testing, etc. And we need to have this testing local and available. Having our residents have to travel significant distances is often a barrier for us in the rural counties. And, again, the opportunity to have free testing where our folks can access that in their local communities is something that we need vitally, especially now more than ever in the rural areas. Yeah, the message has been fairly consistent all along. COVID is something that we need to take seriously. We don't need to be scared of it, but we need to respect it and take it seriously. And, continue to do, the precautions that we're putting out there and that you're hearing a lot of health experts talk about, right? Making sure to wear your mask, keep your distancing, try to reduce densities in your gatherings. I know it's been very controversial with this 10 or less limit when it comes to private gatherings. And if anything I could articulate, it's, think strategically, think around, your own exposures and your own risk of yourself, your loved ones, maybe those that are more, in the senior population or underlying health conditions. Ultimately, we want people to be safe and healthy, but also to be able to, enjoy their family and celebrate these upcoming holidays, but we need to do it in a safe way. Just remember, COVID is everywhere. It's pervasive throughout our communities right now. The number of cases you've seen every day over the last couple weeks, specifically in Genesee County, continue to show that now more than ever we need to be diligent in making sure we're protecting others by protecting ourselves and wearing masks and distancing as we can.
Let me just say one more thing. It is Thanksgiving. My birthday is, I was born on Thanksgiving Day, as some of you know. I usually tell a story about it, but we don't have time today. And Noah, my grandson, will be 2 the day after my birthday, November 24th. And it's a blessing. I hope everyone here, all you young folks in particular, have the blessing of grandchildren. Thank you, everybody. Stay safe and a happy Thanksgiving to you and your families.